Welcome, everyone. Good evening. Welcome to Procure Talks or Procure en Parle. It's always a pleasure to be with you. As you know, information is the first line of defense, so we're presenting the fourth in our series of webinar this year with a new option. As Miriam just explained, you can follow the webinar in your preferred language, either French or English. Today, we'll look at the importance of bone health, especially with men, with Suzanne Morin. She's a physician and researcher at McGill University. We'll also have a presentation by Suzanne Morin, Dr. Morin, and we will then move on to questions. You have sent your questions ahead of time at info@procure.ca. You can also, if you haven't submitted your questions yet, use the Q&A button at the bottom of the screen to do so. We absolutely want to thank our supporters, Astellas, as well as Industrial Alliance. Astellas is there to offer prostate cancer treatment. And we also want to thank the Association of Urologists of Quebec. Without further ado, the floor is yours, Dr. Morin. Hello, good evening. Thank you so much for inviting me here. Let me share my screen for starters. You should have it now. So tonight, we're going to talk about bone health. We'll talk about osteoporosis, especially male osteoporosis, and we'll try to see how we can make sure that bone health is where it should be. We'll talk about screening and treatment as well as prevention. I'm hoping also that we can have a Q&A session at the end. So let's start with a general introduction about bone health. What are bones? They are living tissues. We tend to not think of it that way, but they are living tissues filled with cells. These cells make it possible for your bones to grow and regenerate through time. They're mainly made up of collagen, that's a protein, and then collagen is calcified. We also need calcium in your bones and other minerals like phosphorus and magnesium. And we'll see throughout the presentation how we can make sure that we have a good intake of these minerals as part of our diet. So a healthy bone has some elasticity and it allows to absorb shocks, of course, to a degree, of course. As you know, with younger people, a fracture may happen following an impact. But with a person with osteoporosis, even minor trauma can lead to a fracture. When we're born and then as we grow until we get to adulthood, there are lots of calciums and phosphorus as well. These are part of the bones, and this is what provides structure to the bone. It can be highly elastic, and we often say that bone is there to absorb an impact. It will have a tendency to not break if it is healthy, of course. Bone also acts as a storage for calcium. All of our cells throughout the body need calcium in order to work properly. This means that if calcium doesn't come in adequate amounts from our diet, then we have a bank we can draw from in our skeleton. This is why it's so important to have a balanced diet with an adequate amount of phosphorus and calcium intake so that our skeleton is not the only source of calcium for our body. Why are bones important? Well, of course, they provide structure to the body, obviously. They also allow us to move, obviously, and live with gravity. It protects vital internal organs, especially so the heart and lungs are protected by the ribs. As I mentioned, bones also act as a storage unit for some essential nutrients like phosphorus. It is also in the bones that we generate blood cells, red blood cells to be precise, also platelets, and white blood cells. So very important. These blood cells and these bone cells interact closely together. That means that a lot of communication happens at that level thanks to this proximity. So very important. There are two mechanisms with which bone can be modeled and remodeled. So bone modeling is what we see in children. The bone will lengthen, will grow exponentially along with the rest of the body. So the diameter of the bone grows through time. From the initial bone, there is, of course, always tissue that's added to grow the bone. In adulthood, so around 20 years old, the bone will start to remodel, so to speak. This means that parts of the skeleton will be renewed. So bone cells will be replaced as they age. So there will be bone resorption to make room for new young bone cells that will then be mineralized. So this whole process of remodeling occurs throughout our lives. This means that your skeleton is completely renewed within about 1 year. So if there are any microfractures, if some spots have gotten old and worn out, it will all be renewed so that the bone is always healthy and has a proper elasticity to be functional. We typically have a peak bone mass in young adulthood. This is the maximum strength that bones will have in a lifetime. This typically happens around 20 years of age, but that's also very specific depending on which bone we're looking at. So between 20 and 25 years of age, for most bones, we are going to reach peak bone mass or bone strength. This maximum is predetermined by some genetic factors. So in some families, we think that, we say people have strong bones or large bones. So this means that their bone density is simply greater than average. So genetics account for about 60% of the predetermined aspect of our bone mass. Sex also has an influence. Men have a greater bone mass than women. They have larger bones and their density is greater, both. There's also the fact that physical activity and diet and presence or absence of medication and disease, these must also be factored in order to look at the peak bone mass for a given individual. Okay, yes, this is pretty much what I just covered. There we go, moving on. Okay. Bone strength, like I said, is affected by our diet. We mentioned calcium, also vitamin D, but proteins matter as well. All of these are there to ensure that bones have the building blocks in order to develop and grow. Physical activity is extremely important. We have demonstrated, especially in children who spend a lot of time in front of screens, there are concerns with the ability of children to achieve proper peak bone mass. This is why we need to promote regular exercise, not only for adults, but also with youth, especially teenagers that have, growth spurts. Body weight also matters. So, in general, heavier people have stronger bones. However, being obese, this disadvantage turns into a disadvantage because the bone then becomes actually more vulnerable to fractures. So, between ideal weight and overweight, this is where the bone strength will be at its greatest. But when we move beyond a moderate amount of surplus weight, then we get into issues. If we have a very, very thin people, then there is more propensity for fractures, unfortunately. We can talk about hormones as well. Very important with women, especially. Estrogen is a hormone that's extremely important for bone health. We know that after menopause, when estrogen drops, we see bone weakness that will grow. So this is important to pay attention to. For men, estrogen matters as well, especially during a growth phase and later in life. There's testosterone. So if you have normal testosterone levels in men, then you have stronger bones. So now, osteoporosis, what is it? It's a disease. It means that the bones are not healthy. This typically occurs progressively, unless there is a specific inflammatory disease or high dose of some medication. This can affect bone structure quickly. But typically, osteoporosis is insidious. It doesn't cause any issues until there is a fracture. We talk about bone strength here. The idea here is to assess bone strength through bone density. We need to be careful. These are not interchangeable. They're not quite the same thing. Density is the amount of calcium and collagen ratio. Bone strength is the aspect reflecting global bone health, the quality of the bone, the diameter and the structure of the bone as well. So this is bone strength. All these concepts are interrelated. And we know that bone density is a metric that allows us to foresee bone strength because they're very much interrelated. Osteoporosis is a disease affecting the whole skeleton. However, we typically don't talk about the skeleton as a whole. There are a few vulnerable points, especially the spine, the hip, the wrist, and the shoulder. These are the vulnerable spots for fractures. As I mentioned, osteoporosis especially affects postmenopausal women who have dropped levels of estrogen, men and women who have some comorbidities or take some certain medication. Comorbidities include diabetes, inflammatory diseases. These people also sometimes use medication or hormonal therapy, especially, for instance, with men who have prostate cancer. Same thing for women who have breast cancer and who undergo hormone therapy. We can then see a loss of bone density. Looking at these two images here, on the left you see a healthy bone. This is a hip bone. More specifically, you see the little holes. They're the connections, actually, in the bone. This means that the bone is both strong and elastic. This is where, in these little cavities, blood cells are created. On the right, you see that the density is completely different. We can see that the bone on the right-hand side cannot face a strong impact. Now moving on to men specifically, which factors are to be considered when talking about osteoporosis? I mentioned it earlier. This is a disease without any symptoms. So people typically will undergo a minor fall and then their hip breaks, and then we tell them that they have osteoporosis. Typically, people are kind of incredulous because they didn't have any symptoms. This is quite different. There is no pain associated with this. It's a bit like hypertension. We don't feel anything until someone measures our tension, and there we go. We are made aware of the fact. Male osteoporosis is somewhat common, although it is more common in women. Past 50, 1 out of 5 men will experience a bone fracture in their lifetime due to osteoporosis. There are close to 8,000 men who suffer a hip fracture each year in Canada. In women, this number is multiplied by 3. But still, the numbers are significant with men. What we need to know here is that men generally have greater impacts from osteoporosis-related fracture, so more or higher rates of mortality, greater loss of autonomy following a fracture, and more difficulty getting back to independent living, independent activities, daily activities, and also a higher rate of suffering a second fracture. So the consequence of these fractures are greater in men than in women, even though they're less frequent with men. So it's really important to draw this distinction. With men, the male fracture sites are spine, the shoulder, and the hip. We see some different or similar fractures with women, typically over 50 years old. So the spine, the shoulder, the hip typically occur after 70 years of age. These have great impacts on daily living, of course. We're especially talking about osteoporotic fractures when there is a minor fall. So within the house, just so from just our own human height. Or sometimes people will sneeze or cough and break a rib or a vertebrae. Or by lifting a somewhat heavy weight or pushing a piece of furniture, for instance. In these cases, we can have fractures. What are risk factors related to men specifically? Well, age, of course. Smoking, also use of alcohol, if it's heavy. We have that more frequently with men than women. Also, heavy use of caffeine. However, a moderate consumption of caffeine works, but if you are over 8 cups of coffee a day, then this can have impacts on your overall health. Another risk factor, sedentary lifestyle, a diet low in calcium or vitamin D. If there is a history of osteoporosis in the family or hip fractures, this is also very much to be considered, because we talked about some genetic factors at play here with bone health. If we have had a fracture after age 40, we have a greater risk of suffering another fracture versus someone who didn't have a previous fracture. Same thing with heart failure or heart attack. Even if we course correct, the disease is already kind of settled in, and then we are more vulnerable to another episode. So we need to see each fracture as a signal. We need to know, does this fracture mean that the bone is unhealthy, and what can we do to course correct? The first fracture could be a minor one, but it could be a precursor to further fractures down the road. Also, if we have low body weight or significant weight loss, this is a risk factor, and some medication, and I will talk about that in a bit. With prostate cancer, there are added risks to this list. Some types of cancer can be associated with low bone density at the moment of the diagnosis, but that's a minority. The greater problem is associated with the treatment to prevent cancer from growing or returning. So these medications, such as Lupron or Eligard or Zoladex, will affect bone density. Also, corticosteroids, they are powerful anti-inflammatory agents, and they're often used for treating cancer, not just for prostate cancer. These medications can also have an impact on bone strength because they reduce the regeneration of cells. So, of course, this is important for treatment, but we need to know that it does have an effect on overall health. So it's important to talk about bone health with your physician, because there are things we can do to minimize these side effects. So what are our recommendations? Well, first, an assessment. Assessment of your risk factors to see if, first, you already are suffering from osteoporosis, and second, what is your risk in the upcoming years, depending on your given profile. Osteoporosis Canada is an entity. They produced recommendations for Canada and some guidelines with relation to patients to see how we can make sure that we correctly assess the risk of fracture. This is the crux of the matter. So when should we start screening? In the general population, by 65 years and over, everyone should have had a screening test for osteoporosis. This is where we measure with a specific devices, your bone density, and this gives a score related to bone strength. It's kind of a proxy for bone strength. If someone is at risk, so if you have chronic disease, if you undergo hormone therapy, then we start this process earlier, so around 50 years of age. This is why we typically recommend bone densitometry around 50, because this is around where there will be menopause. With men, we can also start screening in the 50s, especially if there are factors such as a family history. The idea here is for this bone densitometer to measure collagen. We do that on two sides, the hip and the spine, and this gives us an idea of the bone strength. The test itself takes 1 minute. We just lie down on a table and the scan occurs and then computes the overall score. Following that, there are prognostic tools to help us have an idea of the fracture risk. In Canada, 2 tools have been peer-reviewed. One of them is the Frax tool. Those are available online. You can enter your own risk factors online that you're aware of. And if you are aware of your scores for your bone densitometer, you can also enter that, and then the tool will calculate the risk of fracture over the next 10 years. Your doctor can do it for you, but you can do it for yourself. You go to the website here, the Frax website, and it's important to pick the Canada-specific tool, because the tool uses Canadian data. You enter your age, sex, weight, height, and then there will be some additional questions, about a dozen questions. They're not all on the slide here, but you fill this out. It's pretty easy. And then you can have the score of your bone densitometer if you have it. And then you click calculate, and it will give you a percentage of likelihood to suffer from a fracture over the next 10 years. If the risk is lower than 10%, all is well. It's a very low risk, and generally what we recommend is just to keep up with a good diet and good exercise regime. If the percentage is greater than 20%, then we may move on to medication. These are some medication that we can use to reduce a higher risk. So again, above 20%. Lifestyle is crucial here, not just for your bone health, but also for your overall health. That especially includes physical activities. For bone health, we want to have resistance exercises with free weights or some elastic bands. This will be extremely important. The more we use our muscles, the more bones perceive this muscle action, and the more bone cells will be stimulated to produce new cells. Of course, a healthy diet, we've mentioned that already. Now, with medication, we have a few options. Typically, there are 2 families here, or 2 types of medication. One that reduces bone resorption, bisphosphonates, such as Actonel, Fosamax. We can also use some that are not on the slide. We use them a lot less. They're anabolic agents. One of them is rozozumab. Those are more specific medications. But anyway, that to say, we have a few options. So these can be used depending on the patient's profile, on the fracture risk and any adverse effects, side effects, and of course the interest of the patient in using these medications. So of course on an individual basis, you can discuss that with your doctor. Now on to prevention. How do we keep our bones healthy? Well, of course, we're going to again talk about the importance of exercise. This is crucial. We need to exercise at least 3 times a week, if at all possible. If that is too much, then what matters is to do a little bit of exercise regularly and frequently, several times a week, as you're able. So instead of trying to, do 2 hours or more than that, try to just practice exercise frequently, depending on your capacity, your specific capacities, your ability, and depending also on your pain, etc. So if you're able to lift weights, this will be really fantastic. You can do weightlifting sitting down, and there are many websites online where you can have an idea of these types of exercises, especially on the Osteoporosis Canada website. We have videos showing various exercises that we can do if we want to increase our bone health and how to carry out these exercises the right way. We can walk. Walking is great, especially for balance. If you can walk outside, that's even better. Of course, it's important to watch your step, especially over the winter. You don't want to suffer a fall over icy terrain. You can, of course, use a treadmill inside. I already mentioned free weights. Extremely important to use resistance exercise at least 2 times per week. Now, a few tips how to get moving. It's not always easy. It does require some discipline, and sometimes when we have someone to exercise with, it's more interesting to do exercising or to take a walk if we have a specific regimen that we can use, then having a partner helps with that. Try to take some regular breaks in your day and use these breaks to do some exercises, whether inside or outside. This is something that a lot of people are trying to do. There are many places where you can attend also classes over lunch break, for instance, or during the day in general. Now, moving on to diet. Of course, we want to have a balanced diet. We want to have foods that are rich in calcium. We often talk about dairy. Dairy have the advantage of containing calcium, phosphorus, magnesium, as well as protein. So this is a great food for supporting bone health. Milk also is fortified with vitamin D, but not other dairy products generally. So calcium, protein, vitamin D with dairy, good option. We also need to have a moderate consumption of alcohol. Follow the Éducalcool guidelines, and for smokers, we do encourage you to quit smoking. In Quebec, we typically eat a lot of proteins. However, some people do not eat enough. We can eat plant-based protein. There are diets that favor this. If you're vegan, there's no issue there. You just need to pay specific attention to the amount of protein that you eat in order to avoid any deficiencies. Here are some ideas about picking good proteins. They can be lean meats, plant-based proteins, fish, low-fat dairy products also. Now, with regards to fats, we tend to favor plant-based fats, especially those that do not contain a lot of acid, like olive oil. Now about calcium intake. I mentioned dairy products, but also there are products like soy milks and other plant-based milk. These are fortified with calcium and vitamin D. These are very much recommended. They contain as much calcium as dairy milk. So this is important, of course, to get some variety. What matters here is to have a daily intake. This is what can be tricky. We need to be consistent every day, making sure that we have a proper calcium intake. When we try to run these calculations by ourselves, typically we need about 1,000 milligrams of calcium per day. What does this mean? Well, about 3 servings, large servings of milk. It could also be a good piece of cheese. If the cheese is hard, that means it contains more calcium versus softer cheese. Yogurt will work as well. There's also fortified orange juice on the market. And I also already mentioned soy, almond, or rice milk that contain calcium. With canned fish, such as salmon or sardines, there are bones included in that form. So if you like eating these, of course, they're a good source of calcium. With vitamin D now, it's a little trickier unless you drink a lot of milk. So vitamin D is present in milk. Milk is fortified with vitamin D. But we would need at least 4 glasses of milk to cover a good vitamin D intake. Typically, Health Canada will recommend that adults over 50 take a vitamin D supplement to make sure that they're covered in that respect. In Quebec, we spend a lot of time outside. You probably know that vitamin D is taken in by the interfacing of the sun and the skin. So if you're outside a decent amount in the summer, then that's a good thing. However, the capacity of the skin to transform vitamin D decreases with age. So after 65, it would be important to have some extra vitamin D with supplements. This will help also with absorption of calcium and its use in bones. Supplements can be found at your local drugstore. They are very much affordable. You don't need to take more than 1,000 units per day. If you take more than that, it won't be more effective. About 1,000 units per day will do fine. There's also some prescription tablets. There are 10,000 units once a week. So that amounts to a little more than 1,000 units a day. But the idea here is to be able to use it only once a week. So this brings me to our last slide. The takeaway here with bone health is as follows. It's extremely important to get involved with this aspect, with fracture prevention and with preventing osteoporosis. We need to make sure to exercise, to have a calcium-rich diet, also vitamin D and also protein. We encourage you to talk about this with your family physician if you believe that you are at risk of developing osteoporosis or at risk of fractures. I mentioned the Frax tool to that end. You can also, of course, undergo a bone densitometry exam, and this can be done several times over some years to see how the bone structure evolves over time. I will stop with that, and now I think we can move on to questions. Dr. Morin, thank you so much for your presentation. Indeed, we are now moving to Q&A. I have several that were compiled by our team. First, my doctor talked about osteopenia. What's the difference between osteopenia and osteoporosis? Oh, great question. There are various levels of bone health. We don't talk about osteopenia so much now. So if we have a normal bone density, it gives you a T-score, what we call the T-score. It's around -1 to +1. Now, if bone health is slightly affected, then we call that osteopenia. So this is the stage before we get to osteoporosis. Osteoporosis is defined as -2.5 or lower. So either you have, a first stage loss of bone density, osteopenia, and then we have osteoporosis. Typically, though, we call that low bone mass. It's not quite a diagnosis, so to speak. It's a first stage. Another question now. A deficiency in calcium or vitamin D. Can this cause musculoskeletal pain? I have pain in my muscles and sometimes also in my bones. So typically, a deficiency would need to be quite severe to bring about pain. Typically, people will feel weak, but typically there is no pain associated with that. However, if calcium is extremely low, much lower than normal, as well as vitamin D, then we can have severe cramps. People may have heard of a situation where the bone is, or the muscle is always cramped up. But these are some extreme conditions. They are quite rare, and they're typically correlated with certain medication. So it's not something that we would see with just someone who has a little lower, calcium intake. Now, with musculoskeletal pain, oftentimes these are related to some degenerative processes. They can fluctuate over time, or sometimes these can be related to medication that we use for cancer patients. So we need to really take an overall look at our health profile, and your physician can help with that. Now, someone underwent bone scintigraphy. It was negative, but the person says, I have a feeling of pain in my bones. Could it be early stage osteoporosis? Good question. Okay, so osteoporosis is painless unless you get, of course, to the point of a fracture. Typically, a fracture is related to a fall or an impact, something that we can pinpoint. Sometimes we can have fractures in our backs that go undiagnosed because they haven't been really related to a specific event like a fall. So we can have small compression fractures. These can occur kind of insidiously in our spine. So if the bone scintigraphy or bone scan comes back negative, then generally speaking, it doesn't mean that there are no small fractures. So you could have a typical or conventional scintigraphy in this case. Someone else here. I am diabetic, undergoing hormonal therapy for prostate cancer. So apart from hormonal therapy, is my risk of osteoporosis greater due to diabetes? Yes, it is. Diabetes is a risk factor for fractures. This is a risk factor that we recognized in the past decade. People realized that people who suffer from diabetes tend to suffer from fractures more so than other people. This is due to various reasons. Bone material becomes more fragile over time. It's kind of vitrified. So with people who just received a diagnosis, then this isn't quite the case. People with diabetes tend to fall more, and some medication used for diabetic patients also have an impact on bone health. Okay. Do bones regenerate themselves and remodel themselves after hormonal therapy? So typically, we can improve bone density. That's how I'm going to word it. We can do that by using medication that will promote bone mineralization. So during and after hormonal therapy, some physicians will prescribe medication to either prevent bone density from being reduced or to increase bone density. This isn't quite the same process as I was talking about earlier. It's not bone growth like we see in youth. However, it's a combination of reducing the bone loss related to hormonal therapy, and by slowing that down, we promote better mineralization. So then bone strength can be favored, but it's not the same mechanism as we see with bone growth in teenagers, for instance. My doctor prescribed a combination of calcium and vitamin D, but I suffer from constipation and hemorrhoids ever since. Could I replace calcium with dairy and vitamin D? Yes, absolutely. This is what I try to tell people. Typically, people who don't like dairy could find it a bit hard to find calcium in their diet. However, someone who can have 2, 3, 4 servings of dairy products, if that's possible for you, then, take your calcium through diet, because then calcium comes with other nutrients, magnesium, phosphorus, etc. So these will all come together, and all these nutrients have a positive impact on bone health. So if you're unable to do that, if you're unable to eat enough calcium-rich foods, then we can look at medication. However, there are potentially side effects, such as constipation. Okay, another question. How often should we measure our bone density, with or without cancer? So the first test should be done around 50 years of age if there are risk factors, or otherwise starting at 65 years old. Then with the results of that first scan, we can see how frequently we need to do that. So if the scan comes back good, then you can wait about 5 years. If you have a lower bone density, if you're at the osteopenia level, then we suggest to undergo another scan every 2 to 3 years. If there's medication involved, then we recommend another scan about 1 to 2 years after starting the medication, to see if there's a response from the body with this treatment. Can we reverse osteoporosis? Well, we can improve bone health and bone strength. Healing is difficult. We try to reverse a process that's very gradual and insidious. But we can increase bone strength, we can increase bone density, and like I said, there's medication also that exists to this end. However, still, the bone will not get back to its initial stage, like in your teenage years, because we can't restore all the mechanisms that play into forming and growing bones. Another question. On the WED, we talk about the role of vitamin K. Is it important? Should I take a vitamin K supplement? And if so, what dosage? Okay, vitamin K. There was vitamin K. We just actually carried out a study on that. Vitamin K is not especially useful. It's not harmful. We used to think that it could increase bone health, especially with people who were taking some types of medication. But there aren't really any strong benefits that would justify recommending this. If you want to use that, like I said, it's not harmful. There are just costs associated to that. I wouldn't know the dosage. I can't quite tell you. It depends, actually. So it would depend. Okay, another similar question here. Here, my husband takes a combination of calcium and vitamin D. So 10,000 units every week. That's all what I do personally. This person does not have cancer. It's just as a prevention. Is that okay? So using a calcium supplement every day, and then vitamin D also. So yes, definitely you can do that. This allows us to be less strict with your diet, especially if you don't tend to eat a lot of calcium-rich foods. This will allow us to make sure that we have an adequate intake so that the skeleton isn't used by the body as storage, as calcium storage. Could anyone use 10,000 units, or is that only starting at a certain age? Well, typically we recommend that starting at 50 years old. The issue is that this is a prescription medication in Quebec, so you need a physician to prescribe it, and there are costs associated to that. So, if you want to use another more affordable option, then just use over the counter medication where you can get vitamin D that are very affordable. Okay, great. So we're going to wrap up. Your opinion matters to us, and we invite you to fill out the survey that should show up on your screen. Thank you so much, Dr. Morin. This was crystal clear. Thank you so much for your explanation. Thank you also for your support with people who suffer from osteoporosis. Any outstanding questions, by the way, will be answered this week. The next webinar will be held on April 26th from 7 p.m. to 8:30 p.m. We will look at diagnostic tests and medical follow-up. Our conference speaker will be Mathieu Bété, urologist at Hôpital Cité de la Santé de Laval. So please follow us at procure.ca. I'm Winston McQuaid. Thank you so much for being with us. See you in April. Have a great evening.